Good day all, my name is Bidemi Nelson and you are welcome to the Footsteps Show powered by the Shield of Innocence Initiative. Today, we'll be talking about a very important topic, and that is the pandemic going around in the world today, the coronavirus. Joining me to expound further on this topic is Dr. Yetunde Olagbuji. Please join me in our interview session with Dr. Yetunde Olagbuji on the coronavirus and the myths surrounding it. Dr. Yetunde is a consultant public health physician, and she will be enlightening us on the coronavirus and the steps we can take to be safer and to be healthier, even in these precarious times. Thank you again, ma.
You're welcome.
I'd like to know, ma, what exactly is a virus?
Okay, thank you. A virus is a pathogen. And let me explain what that means. It's a disease-causing organism. We have several of them. We have bacteria, we have fungi. Virus is one of them. So they have the ability to cause disease. So that's what a virus is.
Now, with this scare of the coronavirus, what makes it different?
Well, like I said the virus is a disease-causing organism. So coronavirus is not a new virus. It's been found to cause flu, but not at this magnitude. So this is I would say, is a new strain of it that causes flu-like symptoms, and then also has so many other life-threatening symptoms associated with it. So like this current epidemic was discovered in Wuhan in China. That was towards the end of last year, around I think November or so, when we started hearing about it. And because of the highly infectious ability of the virus, it's been spreading from human to human. And because the world is a global village, people travel everywhere, and that's why we have it. It's now a pandemic. Pandemic in the sense that it's an outbreak occurring all over the world. We have close to more than 150 countries out of the 191 countries that are being infected by this virus. So that's why this particular one, I would say, is a reimagined virus. That's why it's really peculiar.
Thank you, ma'am. What are the symptoms?
Okay, the symptoms, we have cough, we have fever, plus or minus fever or so. There's sore throat. There's symptoms like resembles that of pneumonia. You have chest tightness, difficulty with breathing, and I think respiratory distress. Before you now have, sometimes it leads to death. So those are the common symptoms of this current coronavirus that we have ravaging the whole world.
Now, at the level of infection in the world today, we see how many people are sick, and we see the number of lives that have been lost because of this disease. If you were to advise a person who has some of these symptoms that you have mentioned now, at what level should the person go to the hospital?
Well, I'll first say that, let me just start by the case definition. What we mean by that is, what will make anyone suspect that he or she has the virus? Number one, is there any history of travel? Maybe those who came because there are some worst hit countries, like in the Europe, we have America, US, UK, Italy, Spain. Those are the worst hit countries. So most of the diseases that we have, those who present in Nigeria I'll call them imported cases, for those who have visited those places. So there must actually be an history of travel. Then there must be history of contact. Maybe you have somebody who is positive of the disease and you came in contact with the person. So you must also have that. And before I just continue, I need to just say how this virus is transmitted from one person to the other. Because there's so many studies since it emerged last year, so many studies have been ongoing on it. We want to find out the mode of transmission. And what we have currently, in the by WHO, as released by WHO, is that it's spread through droplets. If they said it can survive in the air for close to 8 hours or 3 hours, or so between 3 and 8 hours, then it can also survive on surfaces. Surfaces of we have, we call them fomites. These are non-living things that can transmit the disease, like the door handle, the table, different surfaces and all of that. And so if you have contact with a person that has it and you are able, you touch your hand, because it goes into the body through any of the mucous membrane. What we call that is, you have the eye, the nose, or the mouth. And if you have your hand infected and you now touch any of those surfaces, it's very likely that one will get the disease. And so those are the major areas of the disease. So as a mode of transmission. So when it's suspected in Nigeria, when you have all of those things that I've mentioned, you're having the symptom and you have the history of contact or history of travel, it's advised that you first of all self-isolate yourself, ensure that you don't go out, then don't mix with people in your home. You can have a room where everybody tries to, they don't come near you, since you are still expecting, you've not done your result and you don't test. So it's better you don't infect other people in the family, so you self-isolate. Then I think there's a common NCDC line. You can call the NCDC, or if you are within the state, it's better to link up with the state epidemiologist. He also has the information about all of those things if it occurs within a state. I think there are numbers, you can find that out online. There are numbers that some people can call to actually, once they respond, then they will actually inform you about the necessary steps to take.
Thank you. Does it have a cure?
For now, viral infections are usually self-limiting. Most of, even the ones that are not coronaviruses, the only thing that people do is that they treat it symptomatically. So most of the time, viral infection, they usually run their courses. If you look at measles, it will run its course. But what we do is that they treat symptomatically. If anybody presents with the cough, chest tightness, it will be treated. If you present with whatever you present with, you just treat symptomatically. That's what we are. But a lot of speculations everywhere, online, so many people, because it's not something that is like a new disease, so to say. So people are just using or trying all sorts. And what we have currently is, they say, is chloroquine and azithromycin. Some say with zinc sulfate. That's what we keep reading from, abroad, those who have used it, but we still don't have a specific definitive treatment for it. People are just using also. Some even have the local, prescription for it. Like I watched a lady who developed, who had the symptom in UK. What she used was these are what's it called, orogbo. Yes, bitter cola. She also used the bark of the quinine, what we call dongoyaro. So she blended the two. Then she's been using that, and I think it has actually helped her to reduce her symptom. Then they also use hot water, lemon water, ginger water, all sorts are just out there. So, but I would say for now, people have not come out with that definitive treatment for it. So maybe in later future we might have a definitive treatment for it.
So in the course of getting this virus, if you can still manage the symptoms at home, and you are not sure if you have the virus,
Yeah.
but you have the symptoms and you're able to manage them at home, is there really any need to come to the hospital?
Well, I would say that like I was a doctor talked about, the hospitals are even overwhelmed at the moment because the a lot of people, they are afraid and they don't really know if they really have the symptom or not. But I would say once it's flu like, and some people just by having mere cough, they start to panic. So once you see it's just a flu like symptom, maybe cough, sneezing, and all of that, one can do certain things himself at home. You can drink a lot of water. They talk about vitamin C, which helps to build your immunity. Then you eat properly. You can take fruits. You take a lot of water. Then you try to stop drinking anything cold. You can start taking very as a hot liquid, because if it's the virus, I read that the virus is heat resistant. So it does not really, when the hot environment tends to like kill the virus. So try to ensure that you take maybe hot fluids. They can even take a hot bath, things like that are actually advised. Then they take lemon water. Those are two. Then they also talked about taking pepperish, substances. Yes, maybe soup, make it hot and all that. So it's after a while, if it's just normal flu, it's very likely that it will just go on its own. But if it's not, if it lingers on and you are beginning to have body aches and all of the headaches and stuff like that, I still believe that you don't stay at home. Try to get to the hospital. I'm sure somebody somewhere will attend to you.
Thank you.
Yeah.
So how do we stop the spread of this virus?
Well, I say prevention is better than cure. It's far, far better, particularly around this part of the world, even abroad. Their hospitals are overwhelmed. The health workers are fucked out, there's burnout and all that. So it's better you prevent it. And the first thing is that since get it has to be on the surface of your hand, you need to wash your hand with soap and water almost every time of the day. You have to be conscious of it because you want to be conscious of not touching your face and all that. So you really need to be washing your hands. And if you are somewhere where you don't have access to water and soap, you can take everywhere you go your sanitizer. This is mine. The sanitizer, handy ones, you can take it along with you. And when you know you want to touch your face, just put your sanitizer on your hand, rub it, and you can now touch your body. Then social distancing, because we are human, social beings. We always have contact with ourselves. So it's better people stay at home, stay in your homes. You don't need to be moving up and down, because you keep exposing yourselves to that risk of being infected, because you really don't know. You touch surfaces, you touch different things. So you have to stay at home. Social distancing is very key. Then they say that you shouldn't touch your face. Try not to touch your face. Then you actually obey, cough etiquette. When you want to cough or sneeze, you take along your tissue paper and you dispose appropriately, not throwing it up and down where people can also have contact with it and get infected. So some also talk about face mask, though some say that it's not protective. We keep hearing a lot of things, but the basic ones are hand washing. Proper hygiene is very essential. Then you try to eat very well to boost your immunity. It's very key. Some talk about vitamin C, that one should just take it just for prevention. But I want to say here that the treatments that we talk about, chloroquine and the rest, they are not for prevention. Some people are already using chloroquine thinking that they can prevent coronavirus. You just overdose of it also. It can cause, I heard that some died in Lagos because they went to use overdose of chloroquine. Please, let's err on the side of caution. You don't have to, we really have to relax and try not to listen to very terrible news that you just, fear itself is even worse than the virus itself. So try to ensure that you are not anxious, you are free of fear, so that you can think correctly. Just get information from the right sources, from the NCDC or WHO, websites, and stay clear of all the things that can make you to be afraid.
Thank you very much, Dr. Yetunde.
You're welcome.
As we all can see, it's obvious that we have a lot to do to take care of our health and to protect ourselves. And it's also evident that if you protect yourself and you take care of yourself, you're taking care of tons of other people out there. So it's important to listen and listen to the right information to ensure that you don't fall victim to this virus. It's nice having you with us. Thank you. We've had it all. We have seen what the doctor has said. But it's important we understand that there are certain factors that makes us vulnerable to this virus, now that we know the virus is very real and should be taken seriously. There are 3 things that can make us vulnerable to the coronavirus. And one of such things is the age. If you are above 50 years, please practice social distancing. Stay away from people who are sick and make sure that if you are sick, you self-isolate and get medical help quick. Another group of people who can be vulnerable to the coronavirus is those who have a pre-existing medical condition. For example, if you have a respiratory disease like asthma, or you have diabetes, or you have a cardiovascular disease or a heart disease, please, you need to be very careful at this time. You need to take good care of yourself and ensure that you are not infected with the virus. The third group of people that can be vulnerable and should take good care are people whose lifestyle has not been really too good. We're talking about people probably who smoke. If you are a smoker, please know that the coronavirus eventually is targeting the lungs, and many smokers have lung problems. So at this time, if you are a smoker, you must take care of yourself. Most importantly, you must stop smoking and do everything within your power and within the doctor's advice to make sure that you take good care of your health and you stay safe. Please don't forget to like, follow, and share, and also subscribe on our YouTube channel. I remain Bidemi Nelson, and this is the Footsteps Show, powered by the Shield of Innocence Initiative. I'll see you next time.